evening, everyone, and welcome to this webinar of Restoring Pay for SAS Doctors in England. I'm Dr. Ujjwala Mohite, Associate Specialist in Histopathology and Medical Examiner working at Dudley Group of Foundation Trust and Russell's Hall Hospital in Dudley. And I am current chairperson of BMA SAS committee. Today, we are going to be presenting this presentation along with Dr. Amit Kochar and Dr. John Vinu, who are both deputy co-chairs for negotiation portfolio of SASC UK. Next slide, please. Why are we doing this restoring pay for SAS doctors in England? Because we think we have solutions. We have to value ourselves. What has happened to SAS doctor pay and why does it need to be restored? Exclusion of the 2021 contract from government pay uplifts. Your views on your pay. What are we going to do about it? What can you do?
Thank you, Ujjwala. So my colleagues all tell me that how many doctors are there in the SAS workforce and how will we make an impact? I remember a few years ago, we did a massive conference and we invited David Nicholson. He was the chief exec of the NHS at those days. And he called us the backbone of the NHS. Well, the numbers are growing. You can see that over the years, we've gone up hugely in numbers. So what we do does matter and matters greatly. Next slide, please.
This is a very important slide in terms of pay restoration. And we here describe in this graph as what has happened to the SAS doctors' pay. As you can see, since 2008 and 2009, compared to now, we have had a real terms pay cut of, say, 31%. And in real terms, what's that equate to? It's a loss of more than 3.5 months a year compared to 2008 and 2009. We are working for, literally say, free. Next slide, please. So what has happened in terms of the 2021 contract? The last year, as you all know, most of us know that the government did make a decision that the only people who would get the pay restoration would be the doctors on the 2008 contract. And this was awarded. As a result, the numbers transferring remained well below the projections due to the difference in pay awards. In March 2022, a survey done by us, BMA, showed that SAS doctors were not transferring onto the new contract as they felt that due to the differential pay awards, they would be financially worse off in the new contract and they would be better off in the old contract. And a significant number of SAS doctors did not want a drop in pay, especially in the ongoing financial climate. Next slide, please.
Thank you. So I'm just going to clarify this a little bit further, what John has said. The DDRB is the Doctors and Dentists Review Body. And this takes evidence from a lot of stakeholders, such as the Department of Health and Social Care, NHS employers, etc., etc. The DDRB itself comprises of about 8 to 9 people who are experts in their field. They're from all over, and they have sort of qualifications in statistics, in economics. So they're the ones that award the pay uplift or tell the government. The BMA has the only SAS doctor that goes there to give evidence, and I've been privileged to do this for the last few years. In 2021 and 2022, both times when we did give evidence, we have insisted that the contract apply to all, the uplift apply to all contracts, new and old. And the DDRB itself has said the same, that the uplift should apply to all the contracts. The DDRB has said a lot of things that we believe were true, and the government should have listened to them. However, the government didn't. The main comment of the DDRB was to try and see the SAS doctors being mainstreamed. That is, not being left out and not being isolated. So this appalling treatment by the government not only shows a complete disregard for the crucial role of SAS doctors in keeping the NHS running in the face of chronic underfunding, but also risks making the new contracts that the government agreed with us completely unattractive for people to transfer to. So I just wanted to explain what John had already said. Next slide, please. So, Ujwala, what have SAS doctors told us about their pay?
Amit, in November 2022, we asked the doctors for their thoughts on pay, and 82% of them felt that the 2022-23 pay award was inadequate or completely unacceptable. And 84% of them felt that the exclusion of any uplift on to the new contracts had decreased or significantly decreased their morale.
And thank you, Jola. And now we're looking into the issues which has happened, and many of you have told us through the LNCs, various organizations, that there have been issues with how the 2021 contracts have been rolled out. This particular column, which denotes the specialty doctor pay scale, as well as the scale value of the specialist scale, clearly gives you the truth that the top scale of the specialty doctor is at 82,611, whereas the specialist was 86,93. And this is what Amit was explaining from the previous DDRB slide, that this was due to the uplift which happened only to the 2008 contract. And this made the 2021 contract less attractive to our SAS colleagues and our friends. So there was a low creation of specialist roles. Having said that, in England alone, we have had an impressive 769 new specialist posts being created. But we're not going to stop there. We want to see more specialist roles being rolled out across England so that most of our SAS doctors will be able to pick up those roles and move forward in their career. Next slide, please. So, on the theme of implementation of 2021 contracts, we still persevering on the issues of negating most of the contractual problems. We have issues of SAS development funding, wherein we have seen that we are unable to sort of source the funds in many of the hospitals across England. And we are working closely with NHSC to identify this funding. We have seen that SAS advocates are being appointed but there are far and few in number. And we see that to be rolled across England in all hospitals. The main majority of SAS doctors are specialty doctors. And we all know that most of us, the specialty doctors, they perform at a specialist level, but unfortunately, they are not being seen, or the competencies are not being recognized at their local departments, hospitals, etc. This has been an issue, and we would like to see that, as per the previous slide, that we need more specialist posts to be created, their talent recognized, their competencies recognized, etc. And many a survey has shown that SAS doctors are chronically undervalued. We have been bullied. That is a fact from surveys and harassed. And we take it seriously. And we will work on these issues to help develop a good workplace. Next slide, please.
So
Thank
the
you.
way the SAS committee works is that we have a conference which sets us the policy for the coming year. This was the motion that was passed at the SAS conference. At that point, there was the real term pay fall was 25.4%, but due to inflation, that's gone up to 31%. And this conference then asked the BMA to convey the disappointment amongst SAS doctors regarding sequential below inflation pay rises. And that is what we're doing today to yourselves. The conference also asked to ballot SAS doctors in England for industrial action. We will exhaust all other options first to restore SAS doctor pay, and if we couldn't, then we will proceed for ballot. And whilst we're doing that, in the interim, we will also ensure that you are explicitly and comprehensively briefed about your rights and responsibilities.
So we have written to Secretary of State to raise our concerns around SAS doctor pay and calling for this to be addressed. The key asks in the letter were to value the SAS workforce, include those in the 2021 contract in any pay uplifts awarded to doctors, and meet urgently to discuss the wider pay erosion that SAS have experienced. We have received a response and are currently arranging a meeting to negotiate with the government, and we will update you on this meeting.
Judy, could we see slides
next
11,
slide,
please?
please.
At slide 11, please. And the slide, I can't see the slide player. So yeah, that's it. Thank you.
Yeah. So yeah, thank you. So we also have dedicated a web page on SAS pay restoration in England. On this page, we detail SAS pay restoration calculation and the steps we are taking to restore SAS pay. We also have produced BMA SAS rate cards as a first step to improve SAS doctor pay. We published a rate card for extra contractual work undertaken by SAS doctors in England to ensure that those who choose to do this work are paid fairly and that their expertise is properly valued. We continue to meet JNC SAS to meet quarterly with NHS employers and Department of Health and Social Care through JNC SAS, with meetings focusing primarily on issues arising from the new 2021 contracts in England, Wales, and Northern Ireland. We have used this forum to highlight and try to address the negative effects of decision to award the new contract nothing beyond the multi-year pay deal for 2 successive years on the transfer rate to the new contract. We also continue to work on other guidance and webinars relating to SAS Advocate, SAS Week, job planning, and more. Please update your details. We have called for our members to update their details to ensure we can engage with them on this issue. Please do so if you are a member, and if you aren't a member, please consider joining. We would also like you to engage yourself nationally and locally, like national webinars today, and there is also next week. We'll be reaching locally via SASC regional committees, BMA members relation staff, and LNCs. Next slide, please.
That's the SAS Pay Restoration webpage that you can see on the BMA website. Can we move to the next slide? John, do you want to come in?
Yeah. As many of you know, there has been an increased push across the country about rate cards, and this has been discussed up and down the country in various LNCs. It has not been a friend of many of our hospital management colleagues, but this is something to see that you have value. Our work should not be taken lightly. Our competency should not be taken in any shape or form lesser than anything is supposed to be. So we have produced what is called an SAS rate card, and this is for extra contractual work. And as it says on the tin, it is same work, it should be same pay, as well as out of hours definitions in the contracts do not apply for extra contractual work. So in terms of you extrapolate that to the rate card, and you get a differential pay from weekday to the weekend, to overnight, etc. And please, we will liaise with the current LNCs to see that this becomes a reality across the country. I know it's a small step to start with, but we will hope in the future that this will gain some traction across various trusts. Next slide, please. As with our colleagues, as we know, we are a very diverse group of SAS doctors. We have got doctors working in different levels, different competencies among the SAS grade. And we know, and some settings, we have doctors on hybrid rotas where we work alongside registrars, etc. And we do a tremendous amount of work. And this work is sometimes supervised in terms where you have a consultant on call, you might be on along with the registrar rota, or you might have having rotas just with SAS doctors. And this was taken into account to produce this particular rate card, which again shows a substantial increase to what rates which were proposed by local trusts. And believe me, there are trusts which have taken up this rate card and have moved forward. And I hope in future this will be the norm across all the trusts in England. Thank you. And the next slide, please.
So we also heard from SAS doctors that they were having problems with their pensions in two respects primarily. The first one was the annual allowance, because we had SAS doctors crossing the 40,000 annual allowance limit and suffering because of it, and having to pay a huge punitive annual allowance tax. And we worked very hard with the Department of Health, and we managed to get them to raise that annual allowance to 60,000. So we hope that SAS doctors will not be affected by this. The other problem we also faced with the pensions was that there were associate specialists telling us that their employers were telling them that if they tried to retire and return, they wouldn't be able to return on their associate specialist contract because the grade is closed. And hence they were having to work at the specialty doctor level. This too has been sorted by the new partial retirement. So from the 1st of October 23, you could retire from your associate specialist 1995 pension scheme and carry on paying into the 2022 pension scheme. The only loss would be that you would pay pension on 1 PA lesser than before. But in spite of that, not all our pension problems are fixed. And, you know, our contractual problems certainly haven't been fixed. We have to remember the principle of better the pay, better the pension. So if we can work on getting our pay back into good shape, the pension will also get into good shape. Next slide, please. So what can you do to support the campaign? If we do hold a ballot legally, we will need your postal address as well as your place of work. Make sure you are registered as a SAS grade in order to vote. We cannot emphasize this more. Also, your local negotiating committee in your trust has several SAS representatives. Get in touch with them to register your interest in the campaign and offer your support or stand for any vacancies. Your regional SAS committee will be hosting an open meeting soon. Look out for details and make sure your trust is represented at their regular meetings. A higher vote will mean a bigger impact, both on the ballot and any potential strike action in future. Only BMA members will have a say. So if you're not a BMA member, you cannot vote. There are lots of local SAS WhatsApp groups. We certainly have one in the northwest of England, and it is our aim to get to the 2000 number. If you don't have a local WhatsApp group, speak to your LNC reps about setting one up. I know from experience that these have been very helpful for juniors and consultants on their campaigns, as they allow for a rapid spread of information. We certainly would like to agree to support you and encourage you to stand for local, regional, and national BMA SAS committees. And if you have any local engagement best practice to share, we would really like to see it. I'll give you a web address later. Next slide, please. So the bottom line is, know your value. Help us, and let's fight for our pay, our pensions, our contracts, our colleagues, and our NHS. We will take questions shortly. Can I just ask you to show the last slide, please, Jody, which is if you have any questions or if you have any suggestions or any good practice or anything you would like us to do, please email that address. It is monitored regularly.